with us our Joint Secretary, Sri P.N. Ranjit Kumar, who is brain behind the dissemination of yoga and naturopathy across the country via social media platforms. So we are using this Ayush Virtual Convention Center, which is a social media platform of Ministry of Ayush, to disseminate this knowledge and to have this discussion in this forum. So I welcome all of you to this gathering. Before I move on to Dr. Ranjit Kumar, I'd like to introduce the speakers. We have with us Dr. Sunita Mandal, who is the head Department of Physiology at Lady Hardinge Medical College in Delhi. We have with us Dr. Meena Chandra, who is the professor of psychiatry at Ram Manohar Lohia Hospital in Delhi. And we also have with us Dr. Rajmi Mehta, who is the senior Iyengar yoga expert, who is also along with us, who's also a researcher and who's also one of the advisors in various committees in the Ministry of Ayush with respect to yoga. I welcome all of you. Along with this, we also have Dr. Lata Venkatram, who is a senior obstetrician and gynecologist and a very senior researcher in the field of yoga and women's health, with a lot of publications on PCOS and yoga for pregnancy as well. So I welcome all of you for this uh, intellectual discussion and sharing of the knowledge with all our peers. And over to over to Sri Ranjit Kumarji for a small brief introduction and a vote of introduction. So over to you, sir.
Dr. Rao, thank you so much. I hope I am audible.
Yes, sir. You're audible, sir.
A very warm good morning to all the esteemed speakers who have joined us, as well as to the participants who have joined. And, typically I start on a note of apology. Sorry, my camera is, some the issue with the computer. So I'm not able to come on camera, but I think that is perfectly fine. These are the new hazards of post-COVID life. Um, Compliments to CCRYN and Dr. Rao for organizing this highly topical and very relevant webinar. Um, um, it is typical when we plan activities for yoga, for promotion of yoga, and taking the message of yoga to potential beneficiaries. It's very typical that we look at various population groups and plan accordingly. Uh, Many times in this planning, women as a group, and particularly women in the 40 plus age group, uh, they are in many respects an invisible population group, because many of the activities do not really reach out to this group, this very, very critical group. So that way, that is one of the reasons why from the ministry, we are very happy to see that one program has been designed specifically to target this particular age group. Now, how yoga can benefit women and how yoga can contribute to women's health, that is something which I leave to the experts to discuss, um, being probably one of the least knowledgeable person on this subject in this group. Uh, but what will be the impact of yoga? I mean, yoga helping women to get a hold of their health, and yoga contributing to women at a population scale becoming healthier. That scenario, what will its impact be? That is one area where my thoughts are going to at present. Like I said, uh, women are the often overlooked um, superheroes of our economy. The contributions they do, not only is the direct contribution not fully recognized, the indirect contribution they do to the economy is immense. It doesn't get recorded, it doesn't get into the statistics. But then they are the prime movers behind the economic activity, and many times in the forefront as well. So, An activity like yoga rooted in tradition, an activity which is quite a part of our daily lives, even if as an individual, you or me may not be taking it up, it is very much a fabric of the society. So such an activity can serve this overlooked and partially invisible segment of the population, as well as their health status. So that is what is exciting about this targeted approach of yoga to women's health. I don't want to take much more time, but I would use this small window which I have to call upon all the experts who have joined us to keep supporting the ministry as well as CCRYN in these initiatives, and also to go, yeah, I invite and even request each of you to go a step more and provide us inputs on what are the other activities we can take up in this aspect. Some of you might remember in 2019 we had started a very specific and um, focused as well as directed activity in this area. It was, we had called it YW40 plus. It was a protocol aimed at helping women in the age group of 40 plus to take up yoga on a regular basis. So that was very, very well received. But the field level promotion subsequently suffered a setback because of the pandemic. So that was our first focused initiative in this area. And now, after a gap, I'm glad that CCRYN has taken it up again. And I reiterate my invitation to all the experts who are, many of you are activists in your own rights. So I would request you to support these activities as well as give us some pointers as to what are the future activities we can take up in this area. So thank you once again. Back to Dr. Rao.
So thank you for your kind words and words of encouragement. And we believe all the speakers who are here today will share with all of us their research experience and rich experience where they have been using yoga for women's health. So we have various topics lined up today, and I would give this proceedings over to Dr. Anusuya to start introducing the first speaker, Dr. Sunita Mandal, for this particular for starting this session. Over to Dr. Anusuya. Dr. Anusuya, can you hear us?
She joined, and but I think why she switched off her camera. So you may continue with.
Okay, I'll continue then. Uh, I would like to begin by introducing Dr. Sunita Mandal. Uh, Dr. Sunita Mandal is a very senior professor in Department of Physiology at Lady Hardinge Medical College. She's a very renowned physiologist and a very senior mentor to many faculty in the in physiology and the physiological sciences across India. She is like a very senior figure and mentor to various teachers in the field of physiology, and she's a very senior researcher. She's a member of various committees, including the DST's committee on Satyam, Science and Technology of Yoga and Meditation. She's also heads some of the committees in ICMR, as well as she's also one of the researchers and collaborators with CCRYN on yoga for COVID-19. And she's a very enthusiastic researcher, as far as I know, and she's very eager to do studies in the field of rheumatoid arthritis, ready to do studies in the field of using yoga for nurses as well as for women's health. And a lot of studies have been planned in her hospital in the coming months to start uncovering the mystery of yoga, the science behind yoga, and its benefits on health in various populations. Uh, Over to Dr. Sunita Mandal, please.
Thank you, Dr. Raghavendra, for your kind words and introduction. A very good morning to all of you. And I go on record to give my greetings to Shri Ranjit Kumar ji, Joint Secretary Ayush, Shri Vikram Singh ji, Director of CCRYN. At the outset, let me thank you all for inviting me and giving me the opportunity
Uh,
for the topic.
so you have to come a little bit near to the mic, ma'am. Huh.
Topic women's health is very close to my heart, and I'm very happy to share my findings with you today. So,
Yeah, I'm here.
so my topic for the today's presentation is yoga and stress management for women's health. Now, in the present day, the do-it-all generation of women are feeling the strain of working and are being more stressed than men. Women in the age group of 35 to 55 years of age are juggling many a role. They play the role of a mother, taking care of the children. Most often, it is the woman who takes care of their elderly parents. They have to balance a professional and a family life, and are additionally their personal problems. And hence, they are the groups, the invisible group, who are experiencing the higher stress as compared to men, as per the latest health surveys. What is stress? Stress is defined as a state of threatened or perceived as a threatened homeostasis. Homeostasis, as we all know, is the maintenance of the interior milieu. And whenever this homeostasis is faced with any perceived threat, the body copes up by activating our flight and fight mechanisms. And once we are able to cope up with this threat, exhaustion sets in, and thereafter we return to our normal homeostasis. Now, what is stress? Basically, stress occurs whenever there is an imbalance between our demands and the inner coping abilities. Who has stress? Well, all of us have stress. Is all stress bad? No, not all stress is bad. They can
Dr.
be
Sunita
helpful.
Mondal, Dr.
Yes.
Sunita, sorry to
Yes.
interrupt you.
Yes.
There is some logo which is coming just on your screen. That box, you have to minimize it. Otherwise, it is just blocking the images of yours from our side. Yes. Minimize it. Yes.
Is it okay now?
Yes, yes, yes. Please continue, ma'am.
No, ma'am, no. You have actually switched off your camera. You don't have
Oh,
to switch off your camera.
okay,
So, but
okay.
can you hear me?
Yes, yes. But switch on
And-
your camera, ma'am. Sorry, that has to be minimized
Ma'am,
actually instead of blocking it completely.
yeah, you just have
Switch
to
on your.
switch on your camera.
She will.
Ma'am, it's not on the slide. You just minimize your slide. This time.
I'm
You
doing
click
it.
on the video icon. Yeah, okay, no problem. Just you can just drag it.
Yes.
Yeah, that's.
But how come we are not seeing a video?
I'm not.
Because she
It's
has
still
switched off her
switched on.
camera.
Ma'am, switch on your
Ma'am,
video, ma'am.
Camera.
Camera icon ko switch on कीजिए. Amazing.
Now?
Yes, it is.
Now it has to be minimized, right?
Yeah, I'm minimizing it.
Dr. Ansi, let it go on. Let it go on.
Okay, okay. Yes.
So now it is okay, isn't it?
Yes, it is perfect, ma'am.
So, as I was saying, that we all have stress, and you can see a curve which is plotted with the ability and the demands, and we find that when the stress is too less, then boredom sets in. However, with moderate amount of stress, there is an improvement in the performance and efficiency. But when the stress is too much, it leads to anxiety and a decrease in our performance level. The main components of the stress system are the hypothalamic pituitary adrenal axis, which releases cortisol, and the autonomic nervous system, which releases the catecholamines, and they produce the adaptive responses in case of stress. These adaptive responses can be in the form of behavioral adaptation or in the form of physical adaptation. Behavioral adaptation are manifested in the form of increased arousal and alertness, increased cognition, vigilance, and focused attention. There's suppression of feeding behavior, suppression of reproductive behavior, and then ultimately there's containment of the stress response. Physical adaptation are manifested in the forms of an increase in the cardiovascular tone, leading to an increase in blood pressure and heart rate. Respiratory rate is increased. There is increased gluconeogenesis, and there's inhibition of the reproductive and the growth axis, and again leading ultimately the coping up mechanisms take over and containment of the stress response takes place. The impact of stress is not same in all. It depends, the tolerance depends on the genetics and the development of an individual. So what are these, why is the woman more prone to stress? Probably it has to do with the hormones, the gonadal hormones and oxytocin that makes women more vulnerable to the stress. And the common reasons for stress in women, as I had told at the very beginning, are the acute stresses. That is, when they get stuck in a traffic, they have an argument, it could be in office or home. There are financial issues, criticism, and deadline at workplace. The acute stress, on top of it, are the chronic stresses, which results from the financial implications, this stress of poverty, the family conflicts, discrimination in women, particularly even you see discrimination before birth, the fetal infanticide taking place, then girl-child discrimination. So from childhood, a female faces discrimination into adulthood, and the resultant physical and sexual violences particularly in the developing countries. The symptoms, what are the signs and symptoms of stress? The common signs and symptoms of stress includes headache, migraine, insomnia, chronic pain, frequent sickness, depression and anxiety, cardiovascular problems, digestive issues, obesity, acne, infertility, menstrual irregularities, and decreased libido. Now, the effect of stress on immune response, it is found that there is an alteration in stress. The release of glucocorticoids and catecholamines from the stress coping centers, particularly in chronic stressed individuals, we find that they have a lower circulating T lymphocytes. And in stress, there is also a decrement in the titers of the protective antibodies against the various pathogens. Thus, stress and depression weaken our immune system. The neuroendocrine effector system basically say when there is any social environmental adversity, it is the pituitary hypothalamic axis which is activated and the sympathetic system is activated, which would bring about an increase in the cellular signal transduction and release of transcription factors and gene expression and release of the interferon and the interleukins, and thus bringing about a change in the immune responses. It is also found that these immune responses are linked to depression and other diseases. The sexual dimorphism Dimorphism, which is observed in the inflammatory activity, is thought to be driven by the differences in the reproductive hormones, particularly the estrogen levels. The estrogen appears to have a dose-dependent effect on the inflammatory system, with low doses leading to an increase in the interleukins and TNF alpha. And it is seen that even glucocorticoids, in animal models, it has been demonstrated that glucocorticoids may not work as well in regulating this inflammatory activity in response to the inflammatory challenges in women as compared to in men. So thus, women is more at a disadvantage when they have stress. Their immune system is down-regulated, leading to development of depression and other diseases. Even the social signal transaction theory of depression has shown that it is related to depression pathogenesis, and stress upregulates the inflammatory processes and induce several depressive symptoms. The ovarian hormones fluctuate and modulate a woman's susceptibility to the stress, to the brain structure, function, and the inflammatory activity and reactivity. Insomnia. Insomnia in females is seen to be more. It is in females, the sleep disturbances, which is usually resulting in difficulty in falling asleep or staying asleep, is associated with hormones like estrogens, which also influences the immune responses. And the higher circulating level of inflammatory markers in women than in men appears to be linked to sleep disturbances. Psychodermatologic disorder, it is seen that females, particularly with personality types A and D, have more of acne, psoriasis, and eczema. And these are usually associated with the emotional stresses such as emotional states. And Ku et al. Has suggested in a review that probably management of the stress by relaxation techniques may benefit the psychodermatologic patients. The neurobiology of stress and pain, it is seen that probably stress and pain are the two sides of the same coin. Okay, and the stress and pain mechanism, basically the lines, the thin blue lines depicts the immediate effects of stress or injury, and there is the effect of from the hypothalamus and amygdala and the ventromedial prefrontal cortex. They stimulate the adrenals to secrete cortisol, and if this cortisol secretion persists for a long time, it can bring about a change in the volume of the amygdala and hippocampus and affect and lead to depression, chronic pain, and even it is associated with post-traumatic stress disorders. The estrogen and is also seen to be related in the brain-gut axis, and women are more likely to develop symptoms of GI disorders, particularly the functional GI disorders or functional dyspepsia, such as nausea, early satiety, bloating. And it is the estrogen and progesterone probably has an effect on the GI motility, on the migrating motor complexes, and even prolongs the GI relaxation, the gastric relaxation, and thus attenuates the postprandial antral contractions during the follicular phase when estrogen levels are very high. This shows the gut reflex, the connection between the gut and the brain, that the gut via the dorsovagal complex relates to the amygdala, to the then hippocampus and the hypothalamus to alter the sensations, and particularly and also the sensations are altered when the stress levels are high and even are related to estrogen. Thus, we find that women have more GI disorders, functional GI disorders, as compared to that in the males. Stress also is a common risk factor for obesity. When there is excessive stress, high levels of cortisol makes an individual seek palatable food, so energy intake is increased and abdominal obesity sets in. Moreover, because of this stress, there is sedentary activity, energy expenditure is reduced, and both then leading to weight gain and abdominal obesity. Thus, what we find is stress affects the weight gain and BMI. And chronic activation of the HPA axis is known to alter the glucose metabolism and promote the insulin resistance. Stress is also related to infertility, and it is seen that physical stressors, they perturb a woman's menstrual cycle through the HPA axis, and recent studies have shown that higher levels of stress as measured by salivary alpha amylase are associated with a longer time to pregnancy TTP, and these females are at an increased risk of infertility. Now, how do we reduce stress? There are different tips to relieve the stress, like you can have pleasurable activities like playing with a pet, or taking a nap, or exercising, or doing yoga, or listening to your favorite music. So stress management, we can say, is not a stressful life. It can lead to a stress-free life. And we should take it up as a preventive maintenance rather than the crisis management. And the best way is nothing but making the woman self-empowered. That is the key. These days, in recent times, people are increasingly using mind-body exercises to cope up with the stress. So, how can we manage stress? First, we should know that we have to say a big no to stress. We should have more realistic expectations. We should plan our day, plan our activities, prioritize and execute our activities, reframe our schedule, and have some relaxation techniques, pursue a relaxation technique, manage time, training, nutrition. We should maintain the nutrition, exercise, yoga, have proper sleep, and discuss the problem. That is more important, that we should know how to discuss the problem. Stress management by yoga is these days one of the very important and being taken up by many people. Yoga, which is a very ancient system of the Indian tradition, is basically based on the principle of union of mind, body, and spirit. And it leads to and physical, mental, emotional, and spiritual well-being. It consists of the 8 limbs of given by Patanjali: Yam, Niyam, Asan, Pranayam, Pratyahar, Dharana, Dhyana, and Samadhi. And it is seen that practice of yoga way of life, and yoga can then reduce our cortisol secretion from the HPA axis, bring about an improvement in the neurotransmitter release, and also improve the secretion or increase the secretion of neurotropic factor and immune system, thereby decreasing depression, anxiety, negative symptoms, improve cognition, improve sleep, improve attention, and many related psychosomatic disorders. I would like to share some studies which we have carried out in women in the department. And these studies have been carried in collaboration with CCRYN. In one of the studies by Chetna B and Dr. Chitra, Dr. Sally, myself, and Dr. Piki Saxena, in a randomized controlled trial on prenatal yoga, we have seen the effects of yoga on elevation of labor pain and birth outcomes, wherein we took 200 primigravida in 30 weeks of gestation, and they were divided into two groups of 100 practicing yoga and 100 non-yoga group. These patients, the yoga group, they were asked to practice 30 minutes of yoga in the 30th week, 32nd week, and thereafter every week till the labor sets in. And we looked for maternal comfort, elevation of labor pain, birth outcome, and also measured the numerical pain intensity. Pain behavioral observational scale were recorded. And in the study group, that is the group which were practicing yoga, at follow-up, yes, we started with 100 patients, but at follow-up, there were 75 was there, and this 25 was lost due to some complications or because of the loss to follow-up. And the yoga group showed that the requirement of induction of labor and analgesics was significantly reduced. There was a significant more number of vaginal deliveries and lesser cesarean sections. The first stage of labor was shortened. The tolerance of pain was better. In the postpartum period, the maternal comfort questionnaire was recorded, and it showed the yoga group patients had a higher questionnaire score. They demonstrated a higher comfort level. Also, it was observed that the number of low birth weight babies was significantly less in women in the group who were practicing yoga. Thus, we concluded that yoga is a non-invasive, easy to learn mind-body medicine and complementary health practice, which is effective in elevation of labor pain and possibly improving the birth outcome. This study was then published in Journal of Complementary Alternative and Complementary Medicine in 2018. Another study from our department with collaboration with CCRYN and the Department of Gynecology was carried out by Praveena SM, Dr. Gandhi, myself, and Dr. Jain with Dr. Ratna Viswas from the Department of Gynae. We recruited 67 women within 5 years of menopause in the age group of 45 to 60 years. And of this 67, 37 group were randomly selected for the yoga and 30 were for the control group. We recorded their HRV, the baseline HRV, and HRV after 12 weeks of yoga practice. Yoga was taught by the instructor from CCRYN in the Department of Physiology. And it was observed that there was a fall in the low frequency and the low frequency to high frequency ratio with a significant rise in the high frequency and a non-significant change in the standard deviation of NN, SDNN. Whereas in the non-control group, the significant rise in LF and LF-HF ratio was observed with a significant fall in the HF rate, with a significant decrease in the standard deviation of the NN intervals. And thus we concluded that yoga practice improved the heart rate variability in early postmenopausal women significantly, and thus we concluded that it may have the potential to attenuate the risk to cardiovascular diseases in postmenopausal women. This was also published in 2018. In early 2011, our department took up this study on the effect of integrated yoga practices on immune responses in examination stress. This is the age group between 17 to 25 years of age, and was carried out by Arvind Gopal, myself, Dr. Gandhi, and Dr. Bhattacharya and Dr. Arora from the Department of Biochemistry. And we divided this into two groups, the yoga group and the control group. And we recorded in both the groups the physiological parameters, namely the heart rate, respiratory rate, blood pressure. In the psychological parameters, we recorded the global assessment of recent stress, the Spielberger state anxiety scores. In biochemical, we recorded the serum cortisol, and for immune responses, we recorded the interleukin-4 and interferon gamma. And findings were that in the yoga group, there were no significant differences in the physiological parameters during the examination stress, whereas in the control group, a significant increase was observed. Likewise, for the psychological parameters, stresses, it was observed that though there was an increase in the psychological stresses in both the groups, but this increase, the difference was significant between the yoga and the control groups. Similarly, similar observations were found for the serum cortisol and the interferon gamma. In interleukin-4, we did not get any significant changes, and we concluded that probably yoga resists the autonomic changes and impairment of cellular immunity seen in the examination stress. This was published in the International Journal of Yoga. Another study that we did from the department was again by Anushka Verma, Dr. Gandhi, Dr. Sweta Gautam, and myself, wherein we studied the effect of yogic techniques on heart rate variability in polycystic ovarian syndrome patients. PCOS is a multisystem endocrinopathy of the reproductive age, wherein the patients present with spectrum of clinical features ranging from chronic anovulation to hyperandrogenism, polycystic ovaries, hypertension, insulin resistance, and autonomic dysfunction. We recruited 30 PCOS patients, and as per the Rotterdam's criteria, and we recorded the baseline HRV and at 12 weeks of yogic practice. Again, this study was carried out in collaboration with the CCRYN, and it was observed that with practice of yoga, there was a significant increase in the values of the high frequency and decrease in values of low frequency and the ratio, depicting an improvement in the HRV in PCOS patients. Thus, from these four studies, we can say that yoga can play a vital role in women's health, ranging from the adolescence, where they have to cope up with the daily stresses, study stresses. It helps in attenuating this stress. In the middle age, in the younger age group, more of females having PCOS can benefit from practicing yoga. In the pregnant age group, again, practice of yoga can improve the postpartum comfort and the birth outcomes. And also in the postmenopausal women, we find that there is significant improvement with practice of yoga. So we can say that it is better to be proactive rather than reactive. There is a space between the stimulus and the response, and we have the freedom to choose to be proactive or reactive. And we better choose this and manage our stress. We should stop stressing and start living. Avoid the maladaptive coping mechanisms like avoidance, withdrawal, negative attitude, worry, fear, hopelessness, negative self-talk, resentment, violence, and rather we should promote factors which increases our resilience to stress. That is, have role models who have positive attitude towards life, have more optimism and positive beliefs, find joy and happiness in what we do, smile, and in our day-to-day life, we should compass more of moral behavior, honesty, altruism, have a religious bent of mind and spirituality, seek help when needed in the form of affection, relationship, and social support. We should have nutritious diet, exercise, yoga, and have a proper sleep. And with this, we can manage our stress. And I would end by saying that in the age of uncertainty, it is not the strongest of the species that survive, nor the most intelligent, but the one most responsive to change. So that is what we have to accept change. We have to cope up with the changes in life. Quote and unquote from Charles Darwin. These are the references and my acknowledgement to Dr. Namita, our ex-senior resident. With that, I thank you for a patient hearing.
Thank you very much, Dr. Sunita Mondal. Thank you very much.
Thank you, ma'am.
And it was really wonderful talking because you have covered, because women's health is such a broad topic which is intricately connected with the socio-economic factors, which majorly contributes to the physiological state of a woman, which you have very nicely briefed from the starting, the causes of the stress, which the women play in multiple roles. Because of that, it's easily prone for, or I would say more prone for these stress, experiencing of these stress. Very beautifully explained. And even you have given the evidences also, like why the females are more prone to stress also, like giving evidence even for inflammatory markers also, like higher levels of circulating inflammatory markers, and even the LF ratios and all, which is the sympathetic activity, would be more in females as well. And it reduces, it increases, the parasympathetic activity increases with the HF levels also. So that with yoga interventions. So these things are very good because you have also linked the stress on even how it downregulates the HP and the sympathetic activity and the brain-gut axis. So in this, I would like to know from the context of your slides and all, higher levels of circulating inflammatory markers you have mentioned, ma'am. So is it on a baseline level, or is this just only in those individuals who are experiencing these stress levels? Could you please share your thoughts on it?
Yeah, it is basically people who are stressed. There's an imbalance between the inflammatory markers. Stress promotes more of the inflammatory markers, and like the cytotoxic T cells and all. Okay, and there's an imbalance between our cellular and humoral immunity, and thus promoting more of inflammatory changes in stress. Yes.
Dr. Mondal, your video is freezed, kind of. So
Okay.
we cannot see you. If you can just switch off the camera and turn it on again, this might help. Otherwise, we can continue like this one. So.
Now I think it is visible.
Yes. No, it's not. Anyhow, it is end of the session of this, no?
Yes, it is visible now.
Now it is moving. Yes. Hello, are you able to hear my voice?
Yes.
Yes.
Okay. So, ma'am, there is another thing from your this thing presentation. It is clear that women is having a lot of stress in almost every phase of this lifestyle.
Yes.
So, even from the early childhood, also, if the like any awareness program or sensitizing women that yoga type of this mind body practices would be helpful for her, that things may be helpful from your studies. So,
Yes.
what if you say what methods could be adapted for sensitizing women of from the early age? What methods can be adopted?
Yes, I think we need more. See, in school, at a school level, already I think there is a lot of stress on yoga. And even in the community, if we are able to take up, we are able to sensitize the mothers. That is the first thing that we should aim at. Only when we are able to sensitize the mothers of the society, then can they sensitize their daughters to take up this yoga as a way of life. And from early childhood, if they start practicing this, maybe they would be better or well equipped to cope up with the stresses and later on life.
So
And
I
I
would
hope in
also
the near future there would be change in the society and female would have the liberty to take up as per their choices and are able to do it for themselves. Yes.
I completely agree with you, ma'am. But I also would like to add that not only the mother, because mother obviously understands the daughter, but even the male members of the society, like a father, brother, husband,
They
whoever it
all
is,
that
because
would
they
take,
have.
yes. I think there is a change in the society. There is definitely a change in the society, and in the near this thing, I'm sure there will be more acceptability in our social setup. Yes.
Yes, ma'am. And regarding other yoga practices, generally, would you advise only the physical part of the yoga, or even
No.
more, or more emphasis on the pranayama and the meditation part also, ma'am?
Yes, that's all. It is just not, as I told in one of my distinct slides, that yoga is just not asana. It is a way of life. We have to practice yoga as a whole. It has to be complemented with the discipline, with meditation, pranayam. Only then we can achieve an harmonious life.
Thank you very much, ma'am. Your explanation is fantastic. Even the slides were also so good, and it has been the storyline has been taken very nicely in the way how you can just make the other people understand the role of stress in the life of a woman. Thank you very much, ma'am. Thank you very much. Now, let's move on to our next speaker, Rajvi Mehta. So Rajiv Mehta has been a student of Iyengar Yoga for over 4 decades, having studied directly under Guruji BKS Iyengar, Geetaji Prashant Ji. She teaches public and therapy classes in Mumbai and has been the lead teacher at international Iyengar Yoga conventions in UK, many countries in Europe and China. She has also conducted workshops in the US, UAE, Jordan, and Philippines. She is currently involved in modern scientific research on Iyengar Yoga. She is a doctorate in reproductive biology, working in the field of assisted reproductive technologies, and a convener of the SIG on holistic medicine for the Indian Fertility Society. She is the founder editor of the magazine Yoga Rahasya, which has a subscriber base in over 40 countries. She is also an advisor to the Ministry of Ayush on scientific research and various activities. Now she is going to deliver a talk on role of yoga on menstrual pain. And I please welcome Dr. Rajvi Mehta. Please share your slides and start your session.
Good morning, all of you, and thank you very much to the Ministry of Ayush. Can you see my slides? No, wait, I have to share it.
You have to share it.
Yeah. Yeah, can you see the slides?
Yes.
Okay.
Yes, we can see your slides.
Yeah, so at the outset, I would like to thank the Ministry of Ayush and the Council for Yoga Research in Yoga and Naturopathy for inviting me. And this is, to me, a very, very important topic. In our country or anywhere in the world, 50% of the population is women, and we have a young population. So we have a large number of young women who suffer from pain associated with menstruation just a few days before or during menstruation. And I specifically selected this topic because it's often neglected, often least spoken about. And if you talk to women in any age group, you will find that most of them would have experienced menstrual pain at some point of time in their lives. And there'll be very, very few who can say that they have gone through their life without a single day of pain associated with menstruation. So it is something so common that we have accepted it as something that one has to live with it. And if whether wherever one comes from, whether it's a small village or a big city in India or any part of the world, this is a common phenomenon. So on one hand, we have national programs where we say there should be equality in women, women should be given the same opportunities as men. And as much as I agree to that, as much as I believe that it has to be done, what can you do about the physiology? Because physiology is different, and therefore certain aspects of the physiologies of our physiology prevents or restricts us from doing what we want. Now, what is the common cause of menstrual pain? There are the pathological causes like endometriosis, adenomyosis, pelvic inflammatory diseases. But a large chunk of people suffer from what we call as primary dysmenorrhea, where there is not a very specific pathological cause of pain. And the common symptoms that a young girl more frequently than the older women come up with is abdominal cramps, low back pain, cramp and pain in the legs, nausea, fatigue, and diarrhea sometimes. And as I said, it is so common that it is taken for granted. Now, if we just look around when we ask people, there's a subjective experience that yes, it is common. But when we look at it as from a scientific perspective, and one wants to realize how frequent it really is. So I looked up the literature on the prevalence of dysmenorrhea from various parts of the world, and the figures to me are quite shocking. In a study done in 2019 in Netherlands, where they interviewed 42,879 women, 85% of the women experienced dysmenorrhea, and the most common expression was in terms of fatigue by 71% of the women. In a smaller study in Italy, they too found more than 80% of women suffering from dysmenorrhea, and 43% of them said they suffered from it all the time, each and every menstrual cycle, while about 41% said they had it sometime. A still smaller study in Sweden and the larger one again had the similar figures of more than 70 to 80% suffering from dysmenorrhea. So it is very, very, very common as shown by objective data. And if you look at other countries beyond Europe, you see in Australia, when they looked at young women, 92% suffered from dysmenorrhea. In Ghana, African country, again 83%, and a meta-analysis of 21,000 women from across the world showed that 71% suffered from dysmenorrhea. So it substantiates what we all subjectively know as women, that even objectively, there is a very high prevalence of dysmenorrhea. What is the situation in our own country? Well, we have very small studies coming from rural Tamil Nadu to Chandigarh to Madhya Pradesh, and a very, very small study in Puducherry. Again, here we find the prevalence ranging from 45% to 72%. And once again, it goes in sync that yes, dysmenorrhea is prevalent and young women are suffering from it. Now, having said that, what I want to draw your attention to that dysmenorrhea sees no boundaries. There is no geographical boundary, there is no social boundary. Whichever class of society you belong to, whatever is a socioeconomic status, whether you are educated or uneducated, you become a victim in a way of dysmenorrhea. Now, what are the consequences of it? Well, since it occurs month after month, and for some women, maybe a couple of times a year, they either resort to medical advice, maybe get painkillers, or just sort of stop working. Now, what does the international data say about it? So in a 2015 pediatric endocrinological review said 33% of young girls miss school because of dysmenorrhea. And this data again shows that 70% of women or girls actually had problems with concentration because of dysmenorrhea. They did go to school, but they couldn't concentrate. And naturally, if they cannot concentrate on their work, then 40.9% of these women had poor performance in their examinations. And 38% said that they could not perform their daily activities, and 59% refrained from social activities. So on one hand, we say that we should educate the girl child, the girls should be given same opportunities as boys, they should be given all kinds of facilities, and we should break all the social barriers. Perfect. But what do we do about this physiology? Because here you see that girls can find difficulty in attending school because of dysmenorrhea. Their performance gets affected, their day-to-day activities get affected, and they just cut themselves off from society for 4 to 5 days. And this happens again and again. And naturally, their performance future on gets affected. Imagine having severe dysmenorrhea pain on the day of examinations of a 12th standard. A child who has studied right through the year would have problems. People then start taking medications so that they don't have the periods on those days. So we can realize how severe this problem is. And what is the kind of medical and family and social support that these girls or young women ask for? Even in the European countries, 60% of the school kids and 80% of them in higher education do not talk about it. So it's not that it is in the conservative societies that people don't talk about this problem. They just accept it, don't talk about it, know that they have to just leave it. And this is found in study after study where people don't just do anything about it, just accept it. How many seek medical advice? Only 14% in India seek medical advice. And in many cases, this would be individuals who have pelvic inflammatory disease or endometriosis, or maybe in the, in the just the post-pubertal days, if the pain is too much, they seek medical advice just to ensure that nothing goes wrong. And in a study done in Chandigarh, they found that only 11% visited a physician and 16% in Ghana visited a hospital. So again, it goes on to show, irrespective of geographical location, socioeconomic status, educational status, people just learn to live with dysmenorrhea. So, and what is the therapy that we can offer these people? Well, there could be non-steroidal anti-inflammatory drugs, but how long can the girls keep taking them? What about the potential side effects? I mean, so possibly most of the time they are reserved when they have some very important assignment or work to be done, or oral contraceptive pills. So what happens is that they just learn to live with it. So whether you go to a small town, the mother tells the daughter, well, you are born as a girl child, you have to endure the pain. And thus life moves on for generations after generations after generations. So what do I have to say from this? That this is a very serious problem affecting young girls in the productive phase of their life. And this is one of the potential reasons that sometimes girls find it difficult to compete. Now, having said that, I would like to draw your attention to yoga, which fortunately sees no geographical, socio-economical, or any kind of boundaries. It is meant for one and all across the world. People can seek to yoga as a practice, as a way of life, as my previous speaker said. And here I would like to talk about the quote of my Guru Yogacharya B.K.S. Iyengar, who says that yoga cures what need not be endured and endure what cannot be cured. And as far as dysmenorrhea goes, I would like to say that yes, it helps you cure what need not be endured, at least that you can reduce the menstrual pain that the child faces, or young women, especially young women, face. They don't need to be waiting till they get pregnant and then get a diminishing in the pain, and also learn the ability to endure whatever minimal pain that exists. And therefore, as I go to the second part of my talk, where I'm going to be talking about the yogic practices, I would like to pay my respects to my Guru Yogacharya B.K.S. Iyengar, who for nearly 80 years of his life were devoted to the practice and teaching of yoga to people across the world, and especially at a time when women were not doing much of yoga, where yoga was primarily a domain of ascetics. He brought it to the common people in the world, including women, to an extent that nearly 70 to 80% of the yoga practitioners today are found to be women. And to his daughter, Srimati Geeta Iyengar, who has done tremendous work in the field on yoga for women. And with this preliminary introduction, what I would like to draw your attention to, friends, is that yoga is a practical subject. And even if I were to prescribe what needs to be done to overcome menstrual pain, and this I am expressing in terms of my experiences and experiences of my fellow practitioners over the last few decades, how we have found that yoga helps in overcoming this kind of menstrual pain. Now, one aspect is that one can list out the different practices, but the important aspect of yoga is that it is not what is done, it is how it is done. Because today, a lot of things come under yoga, and we may call all these practices yoga. So it is not something that we can list out like medications, because when we list out the medications and you have a prescription, what happens is that each of these drugs has undergone FDA clearance, and we know what is the quality of that drug. As far as yogic practices are concerned, if there is a massive variation in their quality, there is obviously a massive variation in the efficacy of that particular practice. So having said that, what I'm now going to demonstrate are certain practices which can be done by women when they are menstruating to overcome this pain associated with menstruation, like severe abdominal cramps and lower back pain. Now, as I said, how do we go about something when we want to practice? One is based on physiological rationale. One is based on your experience over teaching hundreds and thousands of people, and when you see similar kind of results. And one is short, small scientific studies which provide the evidence. I am not providing the evidence, but I'm talking in terms of experience. So first and foremost, we know that the major cause of menstrual pain is the uterine contractions caused by the prostaglandins. So the couple of asanas that a girl can do with ease is called as Baddha Konasana. Am I visible, Dr. Anusuya? Yes. Okay. So when one sits,
Yes,
what
you are
we
visible.
call, yeah. So what we do is, what we people do is sit in Baddha Konasana. Now, as I said, it is not just what is done, how it is done. Now, if I sit in Baddha Konasana like this, where my lower abdominal region is totally contracted and collapsed, it's not going to be effective. It's important that the lower abdominal area is lifted up. And therefore, Guruji Iyengar started using household items like, which we called as props, like a bolster or a blanket, and you sit on a height. Then you sit in such a manner, so you're sitting on the frontal edges of the buttock bones. And when you sit on the frontal edges of the buttock bones, you can see the kind of space that is created in the abdominal area. In a common man's parlance, I would say that abdominal pain is caused by uterine contraction, and in this case, we are causing a spread. So this becomes a Baddha Konasana, and a girl can sit in this position even when she is under pain, and sit for 5 to 7 minutes. She can even put a book in front of her, start studying. So sometimes, because to get a young person to sit in a specific position for a long period of time becomes difficult. A variation or another pose is the Upavishta Konasana, where you extend the legs to the side. Even here, it's important how it's done. If somebody's going to be sitting like this in a collapsed position, legs dull, chest sinking, head being pushed out, it's not going to be effective. And one will say, well, I have done Upavishta Konasana as advised by my yoga teacher, but it is not effective. You have done what you thought was Upavishta Konasana. In reality, it is important that you get that spreading. And therefore, even if you don't sit on a height and you are a regular practitioner, then you can even sit on the floor, but get that lift in the pelvic region. But if you are unable to do so, should one do a compromised position and see that it would be effective? If we are not, can we just give a placebo if the drugs are not available and say it's going to be effective? Yes, maybe some people there is a placebo effect and they'll feel good. But will it be effective? No. So that's the reason we sit on a support. And then again, we ensure there is a full lift in the pelvic area, there is a spreading in the pelvic area, and this becomes Upavishta Konasana. This can also be done during menstrual pain regularly. However, also along with menstrual pain, there is also a lot of stress, as my previous speaker said, right through a woman's life. And there are other poses which can be done. In our yogic practices, we lay a lot of emphasis that the abdomen is strongly governed by the legs. There is a common misconception that asanas are a physical practice. Where do we know where the body ends and the mind begins, or the mind ends and the body begins? All are strongly interlinked. Asana, any position that you sit in becomes an asana, as long you have stability in the body and stability in the mind. And therefore, when the practice of yoga, it is important that the asanas also affect the mind, affect the breath. So if I am sitting in the same asana as Baddha Konasana with a collapsed chest, my breathing is going to be shallow. If I sit with a lifted chest, my breathing is going to be deep. So the other asanas that can be done by the people, even during menstruation, to overcome this kind of pain is stand in Tadasana, where they join their feet together, toes together, create a compactness in the abdomen. And you can see that as I raise my knees, move my frontal thighs back, there is a spreading in the abdomen. However, if I were to stand in a casual manner, there's a total collapse in the abdominal area. So it's important to spread the feet, feel that lift in the spine. So this becomes Tadasana. Then we also teach them to do Ardha Chandrasana, where they spread the legs apart, exhale, take the arm down. They can use the support of the wall, And then when they do it, there's a tendency for the abdomen to start dropping down. So we take support, straighten the legs, and you can have a full pelvic rotation. And if the child is weak, even the lifted leg can be supported on a stool. So in this way, again, there is a relief in the pelvic area. Once all these helps, then as I mentioned earlier, there is a common complaint of lower back pain. And this condition, we teach them Adho Mukha Shvanasana. Again, how it is done. By just spreading the palms and feet and hanging like this, there is no effect on the back. In fact, the lumbar area constricts. So we say, straighten the arms, straighten the legs, exhale. So you use your breath, and with an exhalation, you take your head down. Now, if the child is stiff, fine, take a support, exhale, extend, rest the head on the support, and see that you elongate the lumbar area so you can sit in Adho Mukha Shvanasana. And this supports make it possible for a person to remain in the pose for a specific period of time. Then another asana for people suffering from lower back pain is the twisting area. Because of pain and the contraction, you will find that the person in pain tends to sit like this because the pain is unbearable. So I showed about how to lift the pelvic and how to work. So we can sit on a blanket. And then we just teach them. So start with simple swastikasana, cross legs, lift yourself up, exhale, lift the trunk and turn. So this brings the muscle closer to the bones in the lumbar area, and the extension helps in releasing lower back spasms. The same can be repeated on the other side. And then for cramps that are faced in the lower legs, especially the calves, in that case, we ask them to sit in Vajrasana, and if possible, even in Virasana. But here, because, visible? So where they sit on the floor. Now, young girls would not really have a knee problem, but in case they do, or if the pain in the calf is too much, we take the support and we ask them to place the support on the calf and then sit on that. So the weight of the body presses onto the calf muscles and gives relief. So same time, they can actually sit. So instead of sitting on a table, on a chair, we'll say sit in this manner, lift the abdomen, lift the chair, and then you sit in it. So these become what we call these sitting asanas. And now finally, again to overcome the leg cramps from the contraction of the calf muscles, I will just show one last asana, which is Supta Padangushtasana. So you can take a belt, because when one lies down, if they are stiff, they may not be able to hold the toes. So we don't want them to bend the legs, because bending the legs constricts the abdomen. So we say take a belt, straighten the leg, exhale, take the leg to the side. Again, this gives relief to the back, abdomen, and the calf muscles. This has to be done on both the sides, but for the sake of time, I'm not going to show the other side. And then finally, Setubandha Sarvangasana, which is a variation of Sarvangasana. We do not allow the girls to do inverted asanas during their periods, but they can surely do Setubandha Sarvangasana, wherein they sit on the bolster, lie back, and then gently slide down, shoulders resting on the floor, and legs. And they can stay for 5, 7, 10 minutes as long as they want. And then finally, we would end the practice with Shavasana. Let them lie down with bent legs, because when the legs are bent, the lumbar rests on the floor, giving it the much needed relief. And then they can just keep their legs bent over any kind of support, a pillow, bolster, and stay there. So I have just shown a few of the practices that can be commonly done during menstruation, but yoga should not be restricted as a therapy to be done only during menstruation. It should be a practice, right, like my previous speaker said, right through one's life, maybe a couple of times a week, so that it becomes a part of life and not something that you do, but it becomes you. So thank you very much, and I'm open to any questions.
Thank you very much. And it is a very well explained topic from prevalence to its impact and to the support also. And you are an impeccable speaker. I cannot stop myself from appreciating your energy levels. Thank you very much. And the other thing is you have demonstrated using the props, right? How it and it
Yes.
appears seems to be very, very beneficial because even you have highlighted regarding the rigidity. If the person is not that flexible, also there are some other options you have given for them to practice also. So, if possible, if the same can be made as a CD also and can be circulated for the students or for making it as an awareness and sensitizing them if it is really beneficial for, in the interest of the girls.
Absolutely. Why not? Why should girls suffer?
Yeah, that's good. And the other important thing is everybody in a clinical practice, usually these complaints may come while teaching yoga and all. The length and frequency of the session matters because it is highly variable. Some teach for even 30 minutes for 2 sessions a week for 12 weeks. Some say it is 2 hours for 5 sessions. And there are different studies. All the studies are saying that is the end result is yes, yoga is very beneficial for this pain and all, for the menstrual pain and all, they're saying. But what about the sessions? Some are saying 2 sessions, some are saying for 2 hours, some are saying 20 minutes to 30 minutes. How much is an ideal time one a girl has to practice to get rid of these problems?
See, what I would say is that for regular practitioners, they should at least do it twice or thrice a week, and especially when they are in pain. On those days, make it a practice to do it regularly. Let's face it, young girls, if you're going to make it a part of life and you're going to say spend 2 hours a day every day of the week, I can assure you it's not going to last long. It's going to be like a peak and it'll be a fall. So, on a practical term, we should keep it at least once or twice a week. Talking about myself, who started yoga when I was in school, it was just once a week. And I can assure you that if it was done maybe 5 times a week, maybe I would not have continued it for so long. So, of course, the intensity was very strong because it was Guruji Iyengar himself teaching. But even in
Yes.
normal conditions, I would say, even if they do it once a week, so we have children's classes once a week, the point is the children should start liking it. Once they like a thing, they find time for it. So it's no longer therapy, and then they don't need therapy. So I would say at least make it a practice once or twice a week, and a 45-minute 1 hour class for youngsters is enough. You
So
see,
daily
and
for
later,
45 minutes. One
so
has to spend
once
for
or
40
twice a week, once or twice a week.
once
I
or
wouldn't
twice a
say
week.
daily. If it's daily, I can assure you no child is going to continue. You
Yes,
will
the
find
the
one in
dropouts.
100. But if you do it twice a week, and if they like it, they find it beneficial, they find time for it. So then children are smart. So they know what helps them, they will start doing it. And then it becomes part of life.
Okay. It is not just restricted only for the girls who are having these type of a menstrual pain, but if it is being adopted by each and every girl, then there will not be any problem. And as far as other benefits also, there is a possibility that other benefits also gets percolated into that individual.
Definitely. I mean, see, yoga is not a therapeutic science. In fact, the therapeutic aspects of yoga are the side effects of yoga, if I may say, or the byproduct. I shouldn't say side
Yeah,
effects, the
byproducts
byproduct
of
of
it.
yoga.
Yes,
So
byproducts of
having
it.
said that, if they do it from young age, then first and foremost, the whole perception of stress changes. They'll have emotional equanimity. I mean,
Yes,
which child is not going to face emotional ups and downs? Why girls, boys, everybody faces emotional
everyone.
ups and downs. So it
Yes,
gives them the strength to withstand that. They don't see stress as stress. I mean, we talk so much of stress these days. Was stress not existence in my grandmother's time? Was stress not existence in our earlier generation? Stress was there even in the Gita. Arjuna was stressed. So why are we saying that, it is our perception of stress has changed? We are unable to, we see every small thing as stress. So if we cannot perceive stress, then we don't feel stressful. So if we develop this practice, then it helps us. It also gives us a lot of intellectual clarity. I mean, people make decisions which they regret later. But if they
yes.
develop intellectual clarity, then there is no question of these kind of things. So overall, one becomes a healthier human being, and a healthier human being means healthier society. So it's important that we don't take in yoga as a therapeutic science. We don't take it yoga as a profession. These are small things. But take yoga so we become better human beings. We become better in whatever we do. So whether one becomes a homemaker or a teacher or a scientist or an artist or anything or diplomats, any profession, you become better. So and you become happier. So you make a happier society. So if Yehudi Menuhin called Guruji his best violin teacher, I mean, a maestro calling his yoga teacher his best violin teacher clearly indicates that whatever you do, you become better. So I think yoga should be taken up as a practice for yourself.
Yeah, that is really wonderful. And I must thank you, and you've been a very motivational speaker as well. That was
Thank you.
wonderful talking to you. That's what required, especially in the case of practice of yoga compliance. Its motivation is also to be taken care of. That's a wonderful talking to you, Dr. Rajvi Mehta. Wonderful
Thank
having
you.
over
Thank
here.
you.
Thank you
Thank
so
you
much.
so much.
And looking forward for further more webinars with your presence. Thank you
Always.
very much. Thank you very
Thank
much. Now, ladies and gentlemen, let's move on to our next speaker, Dr. Lata Venkatraman. Dr. Lata Venkatraman is a renowned OB gynecologist, and she is the lead consultant at Rangadoro Memorial Hospital, Bangalore. She is also the faculty and research guide at SBIASA. She is one of the national experts on diabetes and pregnancy. She is also the consultant and advisor, as well as a trustee to an NGO, Doctors for Seva. She was involved in the development of mobile platform-based applications for antenatal, intrapartum, and postpartum care. Her areas of interests are medical disorders in pregnancy, yoga and pregnancy, vaginal surgeries, community obstetrics. She has been an invited speaker in national and international conferences, and she has also authored chapters in OB-GYN textbooks and 12 research papers in international journals as well. And we request Dr. Lata Venkatraman to deliver her talk on yoga for healthy menopausal transition. And ma'am, first of all, I must thank you. In spite of your busy schedule, you have adjusted yourself to come over here and deliver your speech. Thank you so much, ma'am.
Thank you. Thank you very much. Am I audible?
Yes, yes, you are audible, ma'am.
Audible.
But the slides, it has to be made into a full slideshow mode.
Don't know. I think it is in full slideshow. You are unable to see it as a slideshow?
Actually, first you would have opened it in the desktop and then shared the slides. Have you done the same?
Yes. Yeah. Yeah. You are unable to see the whole slide?
Yes.
Can you?
No, no, no.
We can't.
Can you just try once again? Would you like to try once again or continue like this?
Yeah. Just give me a second.
Yes.
Can you see it now?
No, no, no.
No. You have just increased the size of the slide. Instead of that, there is a tab, third tab on the towards the side only at the bottom, which makes it full screen.
Yeah.
Yes, this one.
It is full screen.
For her, it's showing full screen for her, I guess.
Okay, ma'am. Can you do one thing? Can you unshare it, and when you share it again, opt for the one which is already full screen, which may not show your image on the screen, but it will show you your slide as a full screen. If you can do that, please. Otherwise, we may continue with this the way it is.
Yeah, we have unshared it. So, yeah, can we share it again? Yeah, please.
Yes, please.
Can you see it better?
The same way. Okay, continue it, ma'am. No problem. Continue.
Are you able to see my slides at all?
No, we are able to see it, but not in the full slideshow.
Oh dear.
Ma'am, you have to reduce the size. I think this is more than 150%.
220. It is 220%. It is kept as.
Yes, let it be now.
Yes. Okay, okay.
Yeah.
Yes, yes. Continue, ma'am.
Well-being of women. I think if we are talking about menopausal transition, we have to talk about the mother being a focal point of existence of all beings, and family becomes center of all human stages of life, and as the mother becomes the focal point of existence. So the woman is a privileged individual who goes through menarche, pregnancy, and menopause. The first two stages, menarche and pregnancy, are very, very important to determine how she transits through menopause into a graceful elderly age group. The facts, I want to take you through few facts quickly. Age of menarche is reducing. It's abnormal if it is less than 9 years. Beyond 15 years, it's again abnormal. So this will have an impact for later years. That's why I just want to tell you about these. Periods can be irregular for 3 to 4 years after menarche, and beware if putting on weight, because it can add on to a lot of issues, especially the polycystic ovarian syndrome. Polycystic ovarian syndrome, 1 in 5 girls in our country are becoming PCOS, which is a multiple endocrinal problem, which has manifestation in different ways. It could be hirsutism, that is unwanted hair growth, acne, obesity, that is mainly central obesity, balding, irregular, scanty periods, etc., etc. The long-term consequences, these girls can be at risk for cardiovascular problems, especially high cholesterol, high blood pressure, type 2 diabetes, and infertility, miscarriage, and the problems of treatment of infertility, etc. They're more prone for cancer, etc. So if a girl as an adolescent has PCOS, I think they should be very careful about their health, because it matters a lot, since these girls can develop lot of comorbidities below the age of 40. The mantra is lifestyle change. I'll come to it a bit later. Premenstrual syndrome is another issue, which actually there is an exaggerated response of the mind to various hormonal changes, which can manifest as somatic problems. So premenstrual syndrome is what is an exaggerated response of the body and mind to the normal changes, physiological changes in the menstrual cycle. So if one is prone for premenstrual syndrome, they might be prone for postnatal depression, menopausal depression, etc. So you have to take care of these symptoms right from your early age.
Excuse me, ma'am.
Yes, please.
Ma'am, your slides are not moving. It was stuck up on the first slide only.
Is it?
Yes, yes. I was thinking you've been moving, so that is why I didn't interrupt you in between.
Oh dear. I don't know why I'm having so many problems.
I was just seriously listening to your explanation and I forgot about the slides as well.
Is it moving?
No, no, no. It is not moving yet.
Oh God. Do you want me to come back again? Because
click on page down button.
Page down. Yes, I am clicking on page down.
It's not
page
moving.
Down. It's not moving though.
With the cursor, you just click that one, second slide. I guess it will move. It's second slide. Slide number 2. Your screen mein, aapka screen mein. In your screen, you just click on the slide number 2.
Yeah.
Is it
I'm
moving?
clicking.
Okay. So it's
just not moving.
Maybe a good idea to share the screen again. Just
yes.
reshare and share again.
Yes. Now it is. How does it present? How does it present?
How
the
does
slide
it?
Isn't that?
Yeah.
Yes.
Okay.
Can you try to move with the next slide? Let us check it. Let us check it whether it's moving for the next slide.
Can you see that?
Yes. Now it is moving. Let us try
in a different way. Yeah. Okay. So if somebody has premenstrual syndrome, they are more prone for menopause. I mean, postnatal, that is post-delivery depression, and also postmenopausal depression or perimenopausal syndrome. So I don't want to sort of talk about the sexually transmitted diseases, which have become such a problem with the youngsters, but I think it is again something to do with the lifestyle. That's why I have just put in a couple of slides. So abstinence is not practiced nowadays prior to marriage. So we see a lot of issues. Menstrual problems, well, very scanty period is becoming more common, or having less than 4 periods a year is also becoming more common. And these women put on a lot of weight. And you, needless to say, that you have heard of all these fibroids, endometriosis, causing lots of issues in women's health. And invariably, they undergo a hysterectomy. And when they undergo a hysterectomy, at a younger age, that is, for example, less than 40, 45, 1 in 5 women can have premature menopause also. That is, the ovaries can stop working. So if the ovaries stop working, they can have lots of issues with their bones, heart, etc., etc. If the ovaries have stopped working at a younger age, not only the quality of life is reduced, but also the other issues can come up. Serious issues like arthritis, spinal fractures, hip fractures can be experienced at an early age because of the osteoporosis. The women are more and more prone for obesity, again due to lifestyle changes, which has got an abundant influence on the menses, and also during menopause there is a central redistribution of fat, and they become quite obese. Quite a few women can put on more than 10 kilos. So it is very important that we take care of all stages of life if we had to have a smooth menopausal transition. Pregnancy, actually, no single period in human development provides a greater potential for long range payoff via a relatively short range period of enlightened metabolic manipulation, both for the mother and the child. Pregnancy, if you can give the best, you can have the best progeny. So it is very important to know how the first 9 months shape the rest of your life. If you are carrying a female child, she is programmed in your womb, and the further mental and physical development of her takes place in the womb, and she is programmed for life within the womb. So 98% of the programming happens while within the womb, and 2 to 3% up to the age of 2. And afterwards, what we add on is like a software to the already prepared hardware. So how the first 9 months shape the rest of your life is a very, very important thing, because most of the NCDs, that is non-communicable diseases, are traced back to the womb now. So tracing it back to the womb, diabetes, hypertension, heart attacks. So as women, if we can give the best to produce the best quality, and if she is a female child, she is going to produce the best quality. So we as women, we affect generations to come. So it's very important that we maintain our health throughout pregnancy. And again, it provides an opportunity for us to look at what is going to happen to our health in future. So developmental environment, the mother's nutrition, that is mal or malnutrition, body composition, stress levels, all these have a great impact on the progeny. So if the mother is diabetic, she can produce a baby who can become diabetic soon in life, and obesity can beget obesity. So preconception period is very, very important. Physical and mental health is very important of not only the mother but the couple, because even the father can influence the quality of progeny, because elevated BMI, that is, if he is obese and because of unhealthy diet habits, etc., reduce sperm motility, etc. So the family on the whole has to be healthy if you want to have a healthy progeny. And during pregnancy, if somebody had excessive weight gain, they are more prone to become diabetic, not only during pregnancy, but they can continue to be diabetic. We unfortunately, the whole nation is having more number of cesarean section deliveries, but unfortunately, that is causing a lot of problems with the progeny's quality of health. So, if we are talking about menopause, we have to trace it back to the womb. That is what I wanted to emphasize. So, as the baby passes through the vaginal canal, vaginal birth produces 80% of 80% of the gut microbiomes develop as it is passing through the vaginal canal. So 80% of immunity is gut immunity. That prevents lot of issues, lot of health problems in the progeny. Diabetes, obesity, hypercholesteremia, all these are attributed to the gut and the programming, that is the microbiomes. So it is indirectly the immunity which we are talking about. So if we have to have a proper progeny, and if we want to have a good healthy adolescent which who grows up to a healthy mother and attains or transits through a smooth menopause, we have to start in the very, very, very beginning. So better maternal health, better progeny, pregnancy is a great window of opportunity. So if you want to give the best and have the best, it is the pregnancy which that is the period that you have to concentrate on as women. If they have developed diabetes during pregnancy, 50% of them can continue as diabetics, rather, they can become diabetics within 5 to 10 years of life. If they have had obesity, they can continue to be obese, or putting on weight during pregnancy can make them obese. If they have had hypertension, that is preeclampsia during pregnancy, 50% of them can continue to be having hypertension in 5 to 10 years after delivery. It might disappear just after delivery, but it will come back. So pregnancy is a window of opportunity to determine what this mother's health is going to be. So it's very important that we take care of all these. And also cancers, as we grow older, they become more common. Cancer of the cervix, cancer of the endometrium, usually postmenopausal, and cancer of the ovary. And if there is a family history of these cancers, then it can be more so, the incidence can be more. So smoking alcohol promotes cancer. Having high BMI, increase in weight can promote any of the cancers, not only the gynecological cancers, but other cancers also. So a word about HPV vaccines. I think it is worth vaccinating your daughters before they become sexually active for with HPV vaccine. I don't want to go into the details of this. Breast cancer has become very, very common, so you have to look after by doing regular mammograms between the ages, probably starting by the age of 40 in our country, at least by definitely 50. If there is a family history, start by 40. Self breast examination is a very, very important thing that we need to practice as women. Just after a period, one has to examine the breast. If they are postmenopausal, probably first of every month, without forgetting, they can examine the breast. Ovarian cancer is another thing. It can be difficult to diagnose. Okay, now the pains of IT. All pains are more common with people who are working professional, especially IT professional, backache, neck pain, hand pain, eye pain, headache, etc. The stress and also the emotional problems which can add on to the stress, and stress adding to the emotional problem and also forming a vicious cycle is very common. So these people will have a rocky menopause. Okay, can have a rocky menopause. Socially, they are more friendly with mobile and their computers rather than themselves. So the middle and reproductive years, I think it's very important that you take care of yourself first. Career, family, children, etc. The stress levels can be very high. The previous speaker was beautifully saying that was not the stress was there all through, but unfortunately it has been perceived as stress more and more and causing more and more somatic problem, that is bodily problem and also mental issues. So why is it happening? Because the lifestyle has changed so drastically. Menopausal symptoms in Indian women, we have done quite a few studies and published nearly 6 or 7 papers. So it can be from head to toe. Okay, but any journal or any this thing can give you this information, but we have found that the urogenital symptoms are much more in Indian women. So how do we take care of this? This is all physiological. Menarche is physiological, pregnancy is physiological, menopause is physiological. But why do we suffer? Because if something physiological is happening, and if there is a lot of stress, it becomes pathological. This concept we have to understand. So, because menarche is physiological, and stress really is physiological to an extent, but how we handle stress is very, very, very important to make sure that we don't develop disease at mental, physical, and of course, intellectual levels also. So menopause is a very important aspect in a woman's life where she needs a health checkup because she is more prone for other problems. Suddenly there is central fat redistribution, not only these symptoms that I talked about, but more of metabolic problem. It is a metabolic event. All these are metabolic events involving lot of hormones and immune system. So menarche, pregnancy, menopause, all these are metabolic events along with some immunological changes. So how we cope with it depends on how your reserves are to cope with the physiological stress. So health check at menopause is very important. You have to make sure that your weight is maintained and you take care of your blood pressure, sugar, and also sometimes if they have attained premature menopause, or if there is a family history of osteoporosis, that is brittleness of bone, we do bone mineral density tests, etc. So bones become weak, risk of fractures can increase, 5 times more common in postmenopausal women. And screening for bone strength after 65 can sort of give you an idea how your bones are behaving. Mentally, I think we have to be very, very active. Me, no pass. So I think we should celebrate menopause. We should add life to their years. So how do we do it? That is by reducing the stress of menopause, educating them properly, asking them to do lifestyle modifications. Very, very important. The stress can bring on diabetes, hypertension, heart problems, strokes, cancer, more in these women. So estrogen actually is very protective for many, many problems. But once we are deplete of estrogens, you can have lots of issues, including stress levels can go up. So diabetes, if your blood pressure is above the 135/80, I think, and also if you're on the obese side, I think it's important that you manage the weight and also have regular checkups. Blood pressure, at least check at least every 2 years, but I would say check every 6 months in the menopausal age group. Sorry, yeah, if the blood pressure is more, you would check for diabetes. Thyroid problems are becoming very, very common. And thyroid is one of the hormones which affects the basal metabolic rates, and we find thyroid issues almost 1 in 3 women or 1 in 5 women in some parts of the country. So cholesterol, I think measuring cholesterol every year is important. Diet, exercise, weight, smoking, all these influence the thyroid levels. We are thin fat Indians. Our abdominal fat is much more compared to other fats. This is the fat which is the culprit, which can cause lot of metabolic issues, lot of problems, etc. So one has to be very careful about the weight gain during menopause. So if you can take care of yourself, it's just not the menopausal symptom. It is all the other things put together. That is obesity, blood pressure, diabetes, thyroid problems. All these have to be checked and made sure that you are not having these problems. So for you to attain a smooth menopause, not only to attain smooth menopause, but menopausal health, postmenopausal is very, very important. So prevention is better than cure. All of us agree with that. So how do we prevent? So we are quite used to mal food. We are no longer malnourished. We are malnourished. That is the biggest problem that we have. And it is not the waist circumference that you see in a woman, that is WASTE, but we are seeing WASTE, that is the waist circumference, and lots of tires, which will increase the tiredness. This culture you know very well. And are we managing our diet properly? Are we eating properly? I think the half plate concept in menopause is very, very important. Half the plate should be filled with fruits, vegetables, and to some extent some proteins. Carbs should be the least, actually. So half plate concept, that is wherever you keep the carbohydrate, that is the rice, chapati, etc., it should be replaced by vegetables, and the proteins and the carbs should be in the smaller compartments of the plate. So healthy balanced diet, protein and iron rich food, milk and milk products for calcium, etc., fruits and vegetables more, and evening meal should be really light. So all these are very important. So it is just not, I'm not just going to talk about yoga because it is important. All of you are yoga experts here, but we have to talk about diet also along with yoga. Yoga brings in the awareness or mindfulness about what we are eating and helps us to control our appetite and also control our tongue in a very big way. So because it brings in mind body balance, and also it's a mind medicine. So how many of us regularly do all these? Very, very important to have some group effect, and that will definitely increase the serotonin in the mind. And menopause can be a challenging period because the woman would be going through a lot of changes. Husband might be retiring, she might be having teenage children who can be really problematic nowadays. The generation gap can be steep. So all these problems put together, menopause can be quite rocky. But how do we make it smooth? By bringing in a lot of lifestyle changes. She has to spend time for herself, which is very, very important. So 150 minutes of moderate intensity activity in bouts of 10 minutes or more each week should be one of the things. And strategies: add walking or biking to your commute, take the stairs instead of the elevator, turn on your favorite music and dance. And stress on stress. Mindfulness: am I getting stressed? Can I de-stress? Not distress. Can I de-stress? Should be always the mindfulness or the awareness that you should be having. Depression can be more common. Stress inducing depression, anxiety, sleeplessness, all these can become a vicious cycle. If you did not have proper sleep, that is menopausal induced sleeplessness, one can have more stress, less sleep, more depression, and things like that. So things can become really a vicious cycle. So are we sort of giving quality time to ourselves? Are we giving some quality time to the family? Are we enjoying with ourselves? Are we practicing yoga, which is our own ancient wisdom? As the previous speaker said very rightly, I think it is a stepping stone to have some benefits of some therapy. You start somewhere, but you have to go deeper and deeper into yourself to understand the very existence of human being. Yeah. So I have to, say that yoga is a stepping stone to reduce stress, reduce anxiety, depression, and alter immune system favorably, promote cognitive function, improve quality of life, etc., etc. And it is a lifestyle modification. Yoga can be considered as a lifestyle modification or a therapy without any side effects. and the therapy happens very much within. There is no external agent, that is like medication, etc., which we give to bring in these changes. So I think it is a very deep science which we have to understand, and also let it be a starting point for us at any time of our life to have a better understanding of ourselves. Let it be an entry point to attain the ultimate bliss, or whatever you want to call ananda, moksha, whatever. So our aim should be from moving from our annamaya kosha to anandamaya kosha, and yoga talks about it very in most of its texts, and it's quite a gross thing that we are using as a therapy, but we should start somewhere. I think it's a life course approach, and which should last lifetime, wherever may be the entry point, here, wherever. Okay, so a small change at the beginning produces many great changes at a distance, just as a tiny shift in a boat's rudder causes a huge shift of the prow. Yoga does this. Yoga does this. I think your future is created by what you do today. Let's start. I mean, it might be an excuse of taking care of menopausal symptoms, but I think for smooth transition, not only for menopause, smooth transition of life, we need a lifestyle change, and lifestyle change is no doubt brought about by yoga. Thank you very much. So never give up. Great things take time, but we can do it. Thank you very much for your patient hearing. Sorry about the hitches with the technology. I apologize.
Thank you very much. Ma'am, thank you very much. Though there are some glitches, but it was wonderful hearing your talk. Really enjoyable also, because how time passed, we never know. Really, it was such an interesting slides also. The way how you have explained is such a briefly and very concisely and so simplistic manner you have explained it. It is not just giving a lecture or something like that. It showed some sort of a personal touch how you're explaining it. Your patients must be very beneficial with your consultations, I guess, ma'am. So maybe that is the reason you're the leading consultant over there. Another thing is you have
Yes.
explained about the half plate concept and all. Everything follows. And another question is, some people may complain, like a woman may complain that they are having almost all the foods in how the doctor prescribes this, that, and all. But do they require even the calcium supplements, even from the age of 40, regular dosage of calcium supplements, though they take 2 glasses of milk or whatever it is?
Yeah. See, around the time of menopause, around 1,200 milligrams of calcium is what we need. Even if you had 2 glasses of milk or 2 glasses of, 2 cups of curds, etc., which Indian women might not have, will give you only max to max 500 to 800 milligrams of calcium. So what I tell my patients is, have 500 mg of calcium tablet, and 500 you supplement it with 500 to 800 you supplement it with the diet. So that is what I say. And I feel for whatever reason women are becoming vitamin D deficient, calcium deficient, etc. I think if we have to prevent, probably you have to take a small supplement.
Just a second, ma'am. Switch on your camera, ma'am, please. You can unshare then.
Yeah, stop sharing, but I don't know, the camera is...
Dr. Ansuya, ma'am, your camera is on. We can see you.
Yeah. So
okay. Somehow I was...
Yeah,
carry on, ma'am. Please continue.
Yeah, so take a small supplement, but do everything else to strengthen your bones and reduce the carbs. Definitely menopause, post-menopause or perimenopause, reduce carbs. Carbs is the one which is causing a lot of problems in our country. Diabetes, hypertension, obesity, everything. So please reduce the carbs and be mindful about what you're eating, please.
Okay. And the other thing is, as far as the hormone replacement therapy is concerned, though side effects have been widely known, still there are certain category of patients that HRT may be recommended. So
Yes.
exactly what would be the criteria for that kind of persons to whom that is a must? It becomes must for them.
Yeah. If they have attained premature menopause, that is less than 40, it
Okay.
becomes very much necessary. If we have, whether they have attained naturally or as a side effect of hysterectomy, or we have removed ovaries for some reason, it becomes a must. Okay. And if a woman is having terrible symptoms and she is unable to cope with those symptoms, affecting the quality of life, you have tried other things, but the symptoms are so severe, then you use hormone replacement therapy. Actually, the side effects have been very much hyped. Actually, the side effects are not that many, depends on how you use it, what dosage you use it, etc. So I think hormone replacement should not be feared, but at the same time need not be given to every postmenopausal woman. It should be rationed and used with caution.
Okay. And the another thing is, from your lecture, it is partly it gives a clue that it starts from the womb.
That's
It
right.
has to be reprogrammed from the womb only, everything. So what if, okay, now this has been, earlier it never used to be that much aware of all these things. Now the pregnant lady eats everything, whoever affordable and all. But already that generation which has been passed and have not been benefited with that one. So if that lady experiences these type of complaints, is it compulsory that every lady will experience these type of a complaints? For example, malnourished during the womb or whatever it is, in general, in general way, from the
So,
common women point of view.
yeah, if I understood your question right, are you asking me that whether all the non-communicable diseases are definitely traced back to the womb? Is it the
Yes.
question? Okay.
Yes.
Yeah. It depends on, yeah, absolutely. One is the fetal programming. It is not the genes. It is the genes, okay, but it is the epigenetic modification. The functionality of the gene is determined by the environment. Okay. And well, while we are fetus in a fetal condition or a fetus in the womb, the programming happens, the levels are set in the womb. So for example, if we are a small baby in the womb, and when you come out, if you are given lot of nutrition and you put on lot of weight, those are the people who can become diabetics, hypertensives early in life. There is a mismatch between what was happening in the intrauterine life and what happens in the extrauterine life. So you have to be aware of this fetal programming, because that is where the human, I mean, the individual's proneness for diseases, physical and mental, is determined. But I'm not saying you can't change it at all. Okay. For example, if it was a small baby in the womb, and if you did not allow this baby to put on too much of weight between the ages of 2 and 7, you can prevent a lot of things. Okay, so that's why I took the menopausal transition to from the adolescent period. So if a girl puts on too much of weight and develops PCOS, she'll be more prone for comorbidities definitely before the age of 40, and definitely so, I mean, more so before the age of 40, and definitely so around the time of menopause. So if she can modify her lifestyle, whatever may be the programming, she can still prevent a lot of problems and have a smooth transition through her life. Does that answer?
Yes, ma'am. Yes, ma'am. Yes, ma'am. That is what. Maybe in developing countries like India and all, the prevalence of obesity has been attributed to that thing only, as you have
That's right.
explained this
Yeah.
one,
We have
because of
lost
that.
the chance with this.
Early onset of insulin resistance are attributing to the reprogramming in the womb itself now. So
True.
that most of the people are not aware of, I guess, so, ma'am. It has to be made aware, maybe from the from your tables only, generally.
Yeah, it is important
From
that
the pregnancy, from the pregnancy stage only, ma'am.
Absolutely, absolutely, very valid comment. And also, it gives us an opportunity. Pregnancy gives us an opportunity to recognize whether this lady is going to become diabetic in the near future. or hypertensive in the near future, because if she develops diabetes, as I said, 50% of them can, though it disappears after pregnancy, after delivery, they can become diabetics in 5 to 10 years time, 50% of them. So if we can ask them to manage their lifestyle, their stress levels, obesity, etc., you can prevent it or at least postpone it. So obstetricians play a very important role in not only looking after the mothers, but also producing quality progeny.
Yes. Yes, very correctly said, ma'am. And the another thing is, generally, as you're explaining about all these things, people who are having these faulty diets and all these things.
Yes. Hello.
I think we have disconnected. Dr. Anusuya is not there. Dr. Lata, you can continue with your comment.
Sorry.
No problem.
Sorry. Something went wrong with the net. Am I audible now?
Yes, please.
Yes, you are.
Yes, ma'am. I just one more question. Like whoever the menopausal symptoms are having, and that person has end up in depression or something, with mind-body medicines alone, do they require any psychological interventions, like psychiatric medicines and all interventions are required for them, or can it be done even without that also?
See, it depends on the severity. If somebody is extremely suicidal, we don't have a choice. It depends on the severity. So if it is mild, bordering on to moderate, we will be able to manage with the mind-body medicine, counseling, mind-body medicine, etc., etc. And also, we have to assess the proneness. For example, if somebody was having severe premenstrual syndrome, or somebody has gone into postmenopausal depression, so you would be asking them to do yoga very regularly around the time of menopause, because they are more prone for it. So you have to identify women at risk. That's why I took you back to the womb.
Yes, ma'am. So it's more of a very individualistic approach. It is showing. Very good, very good. Ma'am. Thanks a lot, ma'am. It's
very much.
really
I enjoyed interacting with you. Great questions.
Thank you
very
so much
for
ma'am.
giving this opportunity. Yeah, CCRYN, Dr. Raghavendra and co. Thank you very much. And
thank you very much, ma'am.
Yeah,
thank you so much.
Thanks for all the help. Thanks. Bye.
Thanks, ma'am. And now moving on to our next speaker, Dr. Meena Chandra. She is an associate professor of psychiatry at Dr. RML Hospital, New Delhi. She did her MBBS from Mahatma Gandhi Institute of Medical Sciences, Maharashtra, and DNB in psychiatry from Institute of Human Behavior and Allied Sciences, New Delhi, and pursued a PhD in the topic of dementia from Guru Gobind Singh Indraprastha University. She was felicitated for her contribution in providing mental health support counseling services to COVID-19 positive patients in Delhi police personnel on August 18, 2020. She has been a co-I and PI in various projects, and she has authored 4 book chapters with over 30 research papers and attended over 50 national and international conferences. Please welcome Dr. Meena Chandra to deliver her talk on yoga for prenatal depression. Please welcome.
Thank you so much for the kind introductions. And at the onset, I would like to thank Dr. Raghavendra, CCRYN, Anasuya, Garima, everybody for giving me this platform to talk on a very important topic. Depression is one of my key areas of interest, the other one being cognition and dementia.
Yes.
So I'm currently doing research on depression in diabetics, a very passionate area for me. But the talk today would be on depression in pregnant women or prenatal depression. So without much ado, I would start sharing my PPT. Yeah, so can you all see the PPT?
Can you make it full? It's not in a full slideshow.
So can you
Yes.
see the slide too?
Yes. Yes. Yes.
Yes,
It's
please.
clear now.
Yeah. So I work in Center of Excellence in Mental Health at Atal Bihari Vajpayee Institute of Medical Sciences, the only medical college honored to be named or renamed after our former vice prime minister. And we start about understanding depression. Like everybody says, I'm feeling sad, I'm depressed, I'm not okay, I'm feeling low. But from a clinician perspective, from the perspective of mental health, what exactly is depression? So when it's such a common colloquial term, sometimes we don't really realize. The
Dr.
first
Meena
thing
Chandra.
is persistent,
Meena Chandra.
pervasive sadness.
Dr. Meena Chandra, are you able to hear me, please? If
So
you have no,
persist.
if you have no problem, will you take out your mask today? If you're alone in your room, if you're
I'm not
alone in your
alone in my room. I'm in the OPD, and another
okay,
colleague of mine is also working in the same room. We are short of
that's
staff. A
okay.
lot
That's
of
okay.
our places are taken up by COVID-19 duties. So coming back to the PPT.
What's going on?
So So the important thing is sadness, which is persistent and pervasive. So what is persistent? That is sadness which persists over time, at least for a period of 2 weeks. So if somebody is sad for one day a week, we don't call it depression, because the next day you might bounce back. The second thing is, if one has lost in whether it's pervasive, that is across situation one is sad. So a person who's sad only in workplace or only at home or only in a certain context, only with relatives or only during commute is not depression. So uh, those are feelings associated with a particular situation or a particular time. But when it is persistent and pervasive, that kind of sadness which does not remit even if you change the location, the situation, the time of the day, and continues for a minimum period of 2 weeks, then we say yes, this has to do something with depression. Then the second very important thing is loss of interest in pleasurable activities or work, or we also call it anhedonia. So even things which earlier gave happiness, like listening to music or doing some exercise or yoga or going out for a walk, they no longer give you happiness. And yes, a very common symptom for depression is also easy fatigability or decreased energy. Now, this is such a vague symptom that a lot of women have the symptom because of some other reasons, like people who have anemia. Can have easy fatigability and decreased energy levels. People who have troubles trouble sleeping, they can also have this kind of symptomology. And so this is sort of vague and non-specific. Then we have sleep changes, we have appetite changes, and then we have changes in our thought processes once we have depression. Includes helplessness. Person believes that nobody will help her, she's all alone, feels hopeless about herself, her future, future of the family, future of children, or apprehension that something bad will happen, and feels worthless, that she is not good enough, she is not worthwhile, uh, loses confidence completely. And sometimes, in severe cases, people start having recurrent thoughts, or they may even attempt death, suicide, or self harm. So, if we look into the the whole set of symptoms. So some symptoms are called core symptoms and some symptoms are additional symptoms. So we say criteria A or criteria B. Criteria A has to be fulfilled before criteria B is talked about. Many times, non-mental health specialists, they make a mistake that they give a lot of importance to criteria B and not enough to criteria A. If somebody is having sleep disturbance or appetite disturbance but is not showing persistent pervasive sadness, then it is not depression. So a lot of times people say that my patient is depressed, and when we assess there is no depression, there might be some adjustment issues, there might be stress, there might be anxiety, there might be a lot of different other mental health issues, but not depression per se. So when we say depression, it has to conform to these set of symptoms. So in mild depression, a minimum of two core symptoms and two additional symptoms should be fulfilled, and the impairment in daily activity should be minor, or person can cope up with a little bit of stretching of resources. They can cope up. Sometimes we have a question that the person says she's depressed, but the family member says that she's able to do all the work. But the person is able to do all the additional work only because she's using additional resources. So two symptoms: low mood, anhedonia, or fatigue, and four of the two of the rest of the symptoms. And for moderate, we have two or three core symptoms and a minimum of two depressive symptoms, with a major difficulty in undertaking daily activities. In our clinical experience in India, women present only with moderate symptoms. When, as long as they are able to work, they do not want to come to a mental health professional for reasons of stigma and lack of awareness. And the family is often not interested until the woman is unable to work. And then we have severe depression, in which the person has all three symptoms of which are core symptoms, and also have additional depressive symptoms. And there is major distress. The person is completely unable to do even daily activities like self-care, social interaction, minimal work. So this is the severe depression. Coming on to prenatal depression. What is prenatal depression? It is a mood disorder which affects women during pregnancy, and that is why it is called prenatal. Natal means the process of delivery. It includes both the pregnancy onset depression and also exacerbation of pre-existing depression. So some women might be depressed to begin with, and then when they get pregnant, it is a joyful time for most people, but they have a, an exacerbation of the pre-existing depression that also falls in the rubric of prenatal depression. And if you try to understand it conceptually, pregnant women would respond to a range of stressful stimuli very differently, because each individual is unique, and the responses might be based on their genetics, their personality traits, their temperament, their coping styles, their previous experience, and the level of social support that they have. So the commonest maladaptive responses to difficult, demanding, stressful situations is anxiety and depression, and they impact not just the mind of the patient but also the healthy progression of pregnancy per se. And pregnancy is a state of physiological stress. That means additional physical, mental, social adaptation is required. Uh, and there have been enough animal and human studies which show that if the mother is stressed, there is increased risk for spontaneous abortions, preterm labor, fetal malformations, and sometimes the children don't grow well. They can have asymmetric growth retardation. So how common is this? So it is pretty common. Nearly 13% women in a study were found to have experienced a major depressive episode during pregnancy. And if we understand that 1 in 4 or 1 in 5 women only present to a hospital uh, if they have prenatal depression, so you can understand that there are very high rates of depressive episode during pregnancy, which remit on their own. I'm not saying that mild depression cannot remit on its own, but it's important to identify, and it's also even more important to prevent it. And we'll come on to that. Uh, a greater proportion of women report depressive symptoms. May not be clinical syndrome, but depressive symptoms are very common. And why we are so concerned that about prenatal or antenatal depression? Because it is associated with high risk for uh, maternal complications like preeclampsia, high blood pressure, pedal edema, pregnancy onset diabetes, spontaneous abortions, pre-birth complications, antenatal hemorrhage, leaking PV, preterm delivery, and low birth weight of the baby. And when these children grow up, we find that they have some emotional and cognitive problems, and there are enough studies which have studied different part of the impact of prenatal depression on the mother as well as on the offspring. So, if you look into the evidence-based approaches for prenatal depression, as the previous speaker rightly said, if the depression is mild to moderate, non-pharmacological approaches are preferred to avoid the risk of pharmacological intervention to the unborn child, and non-pharmac approaches may also be used as adjuvant intervention. However, if the depression is moderate to severe in intensity, then we have to give antidepressant treatment, which are the mainstay of management. And in very severe cases with suicidality, even ECT has to be given. If you look into the non-pharmacological approaches, which traditionally have been offered to women with prenatal depression, we find psychotherapy is the most common intervention, and it has the most largest evidence base. These include psychodynamic and cognitive behavior therapies, but we have to understand not every patient is psychologically sophisticated to participate in CBT or psychodynamic psychotherapy kind of interventions. Then we have traditionally used sleep hygiene, nutritional support, lifestyle changes, avoiding nicotine, caffeine, alcohol, using some relaxation techniques, social support groups, and if somebody has seasonal affective disorder with depression worse in winter months, if there's a history like that, we advise them to go out in bright sunlight, especially in the morning, follow the circadian rhythm and follow the sun cycle, get up with the sun, sleep with the sun, and all these approaches have been found to be beneficial. And if you look into prenatal yoga, because not all studies have uh, offered a comprehensive package. Some studies have focused only on breathing, some studies have focused on postures, mindfulness has been used, relaxation has been used, meditation has been used, and some studies have integrated various components to provide a package of care. So let us look into the general benefits, which will benefit everybody, not just women with prenatal depression. There is enough evidence that women who perform yoga during pregnancy have better sleep, better quality of sleep. There is reduced level of stress and anxiety in them. There is also a physical benefit. The strength, flexibility, and endurance of muscles which are required for childbirth is found to be increased. These women also have low levels of other symptoms very common in pregnancy like nausea, vomiting, low backache, headache, shortness of breath, various aches and pains. uh, Prenatal yoga helps women adapt with their body changes across 9 months of pregnancy with a lot of grace. There is a sense of bonding and connection with the unborn child, and it is also said to improve and strengthen mental health. Coming on to the understanding about the evidence base for yoga for prenatal depression, over and above what yoga can do for any woman. So, in Kramer et al. In 2013 did a systematic review as well as a meta-analysis for various studies which had been performed till then on the impact of yoga in prenatal depression. They identified 12 randomized controlled trials involving 619 pregnant women, of which only 3 had low risk for bias. So 9 had some kind of bias built into the methodology, and we will discuss how a good methodology looks like when we plan an RCT for prenatal yoga. And the women in these trials, the 619 women in these trials, were between 20 to 40 years of age. And they found by pulling the data of the 12 RCTs that there was a moderate effect and a short-term beneficial effect of yoga with the p less than 0.001, and also there was an impact on anxiety, of very positive impact on anxiety. Then another meta-analysis and systematic review was conducted by Gong et al. In 2015, and they identified 6 RCTs without any bias. So Kramer et al. Had 12 RCTs, but there were only 3 without bias. But Gong et al. Focused only on 6 RCTs without any bias, involving 375 pregnant women, again 20 to 40 years of age. And here the diagnosis of depression was very robustly made by a trained mental health professional using SCID and Center of Epidemiological Studies depression scale, and they found that the severity of depression was significantly reduced in the yoga group. And on some analysis, they found that depressive symptoms were reduced not just in the depressed groups, but even non-depressed women who had isolated depressive symptoms, even they benefit as regards to a positive mental health. Then the types of yoga protocols which were performed in these 6 RCTs. So some of them had only physical exercise based yoga programs, and some of them had integrated yoga programs involving physical exercise, meditation, pranayama, and deep relaxation. And they found that depression was significantly improved in the integrated group as compared to only the physical exercise group. So while the physical exercise group was beneficial, the integrated group was benefited far more. So Kramer et al. Concluded that yoga intervention in pregnant women would be effective in partially reducing the depressive symptoms. But there are also negative studies for prenatal yoga. So Phil et al. Did a study on 92 prenatally depressed women who were randomly assigned either to yoga or a control group, which was a social support group, and they recruited women at 22 weeks of gestation. So right before the end of the second trimester, so they have recruited women late in the pregnancy, and the women underwent 20-minute yoga intervention sessions, only the physical poses, once a week for 12 weeks. And the control group was a social support group. It was a discussion group. It had no leader. The women just discussed their issues between themselves. And as expected, the yoga group had not just less depression, but less anxiety, less anger, less backache, ache and leg pain versus the social support group after the first session. However, at the end of 12 sessions, both the groups performed similarly. The depression, anxiety, anger score, and relationship scores were similar in both the groups. This study also had biomarkers like cortisol levels, which are the marker of stress, and it was found that both groups had showed decrease in cortisol levels, and estradiol and progesterone levels were found to be decreasing after the last session in both the groups. So this is a study which states that prenatal yoga may not be beneficial, and we'll come to the limitation of the study. There has been several criticisms about studies like this. If there is a no standardized manual based intervention, we cannot ensure quality of the intervention, and that could be a reason why the yoga group does not perform better than the control group. Sometimes we do not understand the acceptability and interest about yoga in the target population. Most of the studies have been conducted in the West, where the participants may not be aware or may not be willing to accept yoga as a intervention with any, and may even have strong negative beliefs about yoga also. Unfortunately, as I'll state in my future slides, in India we are not doing good any research on prenatal yoga. There is no pilot testing, so they just go straight into the RCTs. The control group should also be credible. Sometimes non-standardized interventions have been used. Like in one study, all they did was they provided yoga DVDs and yoga mats to the participants and say, "Oh, you look into the DVD and you perform yoga." And as all my very erudite yoga interventionists attending this program will know, that teaching somebody yoga requires a great amount of skill and patience, and yoga cannot be learned adequately by just watching a DVD. And sometimes the yoga interventionists were also untrained, especially from prenatal perspective, because a lot Some of the yogic practices need modification or may not be suitable for women in pregnancy, especially during the last trimester of pregnancy. So Battle et al. Came up with a very nice design in 2016. They did in phase one, they did a patient survey for acceptability and interest. Then they did an open trial. Then they did a pilot trial, and then only they went for a large full scale RCT. So the intervention was fantastic. There was a detailed written intervention manual. So everybody knew what they were supposed to do. The components down to opening greeting, pranayam, breath awareness, uh, gentle movement, standing poses, floor poses, lying down poses, final resting pose, final pranayam, and class closing. Everything was manualized. So there was no gap in the quality of intervention which was given by one interventionist as compared to the other interventionist. And they utilize registered yoga teachers who again received training prior to the study, because each study protocol is different. So they got study specific training and prenatal yoga training. And the instructors were given, were also trained and told to demonstrate and encourage non-judgmental focus, mindfulness, breath awareness, have a non-judgmental attitude towards pregnancy and birth-related choices, and the yoga teachers are also made aware that the participants might be undergoing their own um, difficulties about their pregnancies, about the positive and negative reactions to the pregnancy, and they may have varying degrees of attachment to the developing baby, especially single. This study was done abroad, so single mothers, mothers who had been abandoned by the partners during the course of pregnancy might have very mixed feelings regarding the developing baby. And if you look into these charts, they are self-explanatory, such beautiful charts. They found that depression scores declined both on QITS, which is observer rated, and also on Edinburgh postnatal depression scale, which is self-rated. So the participants themselves felt that they were less depressed, and the observers could independently identify and demonstrate that the women had benefited. It's a small study, and there was only 32. But see how beautiful the study is, that we are getting straight lines showing a downward trend for depressive symptoms after the intervention. Then the question arises that if women do yoga, would the benefit of yoga persist beyond the intervention? Yes, when we teach women in a trial how to do yoga, we expect that they should continue with it. But if they don't, would they still continue to be benefited? So, a very nice study on this aspect was conducted in Java, Indonesia by Yulianti et al. In 2018. They realized that towards the end of pregnancy, because of the last trimester and impending delivery, women might not be able to perform yoga protocol, or might not be able to perform it completely, especially the physical poses. And they found that even when the intervention was stopped, the benefits of yoga persisted for mental health at 2 weeks and also at 4 weeks. So, if somebody at 36 weeks of pregnancy, and we know delivery is expected to occur at 40 weeks of pregnancy, so if somebody at 36, 35 weeks of pregnancy stops performing yoga due to any reason, the benefits for antidepressant of effect of yoga actually continue, and that is such a wonderful finding. So if we look into the Indian scenario, we find that there are a lot of prenatal pregnancy training programs offered by different institutes, 100-hour program, and some people have 116 yoga centers and ashrams offering prenatal yoga both for pregnant women and also for their trainers. They're running training courses. However, nobody has done any study on the impact of prenatal yoga on any outcome in India, any outcome, be it subjective well-being of mother, be it physical pain symptoms, be it hypertension, diabetes, preeclampsia and pregnancy, uh, be it mental health outcomes like depression or anxiety, be it delivery outcomes. Did the women have full term delivery? Was the baby healthy? Did they have preterm delivery? What were the rates of LSCS in such women? What were the rates of post birth complications in these women? What about the infant? Was it appropriate for age? What did the infant weight match the average weight, or did the infant do very well in the first week of delivery or first month of delivery? Cognitive outcomes, behavioral outcomes. So there is no research at all. When acceptability for yoga is very high in the Indian population, and if a prenatal yoga program is offered, most women would be happy to take it. But this is our lacuna, this is our shortcoming, that we have not tapped, or we have not systematically researched on the impact of prenatal yoga. The field is wide open, and I hope some younger researchers or even more senior ones take up prenatal yoga as an intervention and study the composite physical, mental health, and obstetric outcomes. That's very important. How do we generate evidence? Unless we generate evidence, we'll never generate it. So to conclude, yoga is evidence-based adjuvant intervention for prenatal depression. It should be routinely offered to all pregnant women if they are medically fit for it. This is my recommendation. But I also would like to emphasize there is need to have credible Indian research on the impact of yoga on physical health, mental health, and also obstetric outcome. Thank you so much.
Thank you very much, Dr. Meena Chandra, because it has given a very, the concepts of depression has been given very clarity on those things, and the management, even you have highlighted in the limitations also, and the final emphasis was very clear, unbiased. It was very nice. Thank you very much,
Thank you.
Dr. Meena Chandra. And only one simple thing is, in India, 13% of the people are experiencing this prenatal depression generally. That has been noted. Silent cases may be there. But actually, what could be the main or the important reason for happening or experiencing these type of prenatal depression? What could be the primary thing or the very highlighting thing for them?
Yeah, so when we talk about prenatal depression, we cannot say that it is due to one factor or two factors. It is always multifactorial. Genetics is important. Not everybody who is in a difficult situation. Uh, okay, genetics is important. Not everybody in a difficult situation would have depression. So we have genetics. We also have nutrition. Let us understand that most of our population is undernourished uh, in terms of micronutrients, in terms of protein, in terms of minerals, and pregnancy increases the demands because of the developing baby. It increases the demand for iron, calcium, manganese, zinc, which a lot of our pregnant women are not able to have, or they may not even be aware about it. The third important thing, which is very important for pregnant women in India, is there is most of the pregnancies are accidental. There is no planning for pregnancy. So a woman never looks after her health, becomes physically fit, takes care of her anemia or low vitamin D levels or low calcium levels before she plans pregnancy. She gets pregnant, and then we get to know that she's having underlying deficiencies, which also need to be corrected, and they have physical impact also, and they also have mental health impact. Another very common phenomena that we are seeing right now is hypothyroidism in pregnancy, and first time detected during pregnancy. So that also requires correction. And then the social factors, yes, the social factors about nuclear family, poor social support, first time mothers finding it difficult to manage, or women with a lot of children finding it difficult to manage their with women with lot of children finding it difficult to manage their household duties along with pregnancy. And one peculiar problem that we see in India and South Asia as compared to the other countries is the fear of having a female child. And let me be very candid about it. It's a genuine fear for a lot of our women who are in traditional and not so traditional households, especially if they already have a girl child. So that apprehension and worry somehow translates into depression as well.
So it's all multifactorial and very socioeconomic factors are being involved in it. Yeah. Thank you very much. And now I would like to inform that the director had to attend a meeting in ministry, and so he could not be there for giving vote of thanks. So on behalf of the director, I thank all our speakers for sharing a very valuable information and highlighting that information in a very practical approach rather than just theoretical. And I really appreciate on behalf of CCRYN, and we look forward for future talks on important topics what we had today. So we also thank the Ministry of Ayush for your support and our CCRYN team as well for their cooperation. Thank you all. Thank you very much.
Thank you. Bye-bye.
Once and all, we thank very much. Thank you all.
Thank